Hello, everyone. Welcome back to my YouTube video channel today. I have about 15 minutes. I would like to uh, share with you two topics today. One is called "What is the role of the dentist after pandemic?" And the other one is uh, the terminology called dental tourism. You travel to different country and you do dentistry from other country. I want to talk about these two topics. So let's jump right in. I have my presentation ready. I'm going to share the screen and so we can come in and discuss this right now. Okay, let's jump right in, guys. Thank you for joining me today. Appreciate your time. I'm going to share the slide. Again, I mentioned to you today, I will have two topics, really short, 15 minutes. The role of the dentist in after the pandemic, and the second controversial idea about dental tourism. Those topics are very hot today. So the next slide I want to show you is the reason I show this picture with one of the medical doctor and one of the doctor friend teaching at UCSF, Dr. Tuan Lei and Dr. Tuan is the Dr. Tuan is the family doctor, Dr. Tuan Lei is the pediatric dentist, and then I am a general dentist. I want to share this slide because I want to talk about the role of the general dentist after the pandemic. It's very important to recognize that we have several roles to help the patient population locally to move on and continue their care. So the role of us is we take care of emergency cases. There's a lot of emergency coming to our door. Second thing I will talk about is helping the patient to get back on track their normal oral health. After the pandemic, there's a lot of problem in their teeth. Third one is identify potential risk of undiagnosed of dental and medical issue that patient come in during emergency or coming back from the dental visits after 2 year, 3 year of not seeing a dentist. The fourth one is the role of the general dentist is to collaborate with the dental specialist as well as the medical specialist team to help to improve the overall health of a patient. Very important concept. The fifth point I'm trying to make is we as a general dentist can educate the patient on the benefit of having a healthy teeth and mouth. For sixth thing is we also, at the role of a general dentist and a family dentist, we can encourage and support patients to see their primary doctor, to see their primary medical doctor, optometrist, chiropractor specialist, and subspecialist for to encourage them. So I'm going to break down the detail right now. Next slide here is treating a lot of emergency case. Now, during the pandemic until now, I have seen numerous of dental emergency case come to my office. Now, I'm talking about post-pandemic. Post-pandemic, people are so scared to the virus that they don't come to the dentist for 3 years. What happened? They have multiple breakdown of their mouth. They have accumulate pretty much a lot of dental procedure left over, and as well as new dental medical procedure that need to be a dental procedure that need to be done, and it costs tremendous. And also they always come with an experience of the painful experience a dental chair because of the emergency. Emergency could be a toothache, a swollen face, a wisdom tooth problem, and the tooth need to be removed, or the tooth is broken, need a crown or an emergency treatment for cosmetic reason. And the other thing is understanding that the cost of the normal cleaning and preventative procedure is a lot less expensive than an emergency visit. So I want to get that point straight. So what are the role of the general dentist? We're helping the patient to get back to their normal oral health. How will we do that? After a long period of missing dental appointments, it takes a number of dental appointments for an average patient to get back to a routine procedure, it takes a lot of dental visit. We need to do deep cleaning for them. We need to do some major procedure like crown, root canal, broken dentures, so many things. So it takes time for several dental visits after the pandemic for a patient to get back onto their feet for routine cleaning. Uh, after the pandemic, you would see patients have bad gum infection, heavy calculus, damage to the oral appliance, the prosthetic, the mouth, the bridge, veneer, all kind of problem come together at the same days for the patient. The dentist can be overwhelmingly have to be treated. So we're helping the patient to take care of them. And your family dentist can do an exam and most likely can give you a baseline from how you look like before and now. We have a comparison. We look at the x-ray, we can tell you how bad your teeth is. Why is it important? Because we want to get you back to the right track. We need an exam again. Knowing that the work needs to be done, you can plan out your time and financially to repair for your dental visit. It's important to go back to the dentist now. Okay, after the pandemic, it's time to go back. The reason I put a statement, the old statement saying that you don't know what you don't know. What does that mean? It means that a lot of patients, they thought that they're doing okay, they don't need to see a dentist. But when you wait that long, you're going to have a lot of problems. So we encourage patients to come back by now. The next slide here is we can identify the potential risks of undiagnosed dental and undiagnosed medical problem. We see that patients haven't seen the dentist after pandemic. They tend to be overweighted. They tend to develop undiagnosed pre-diabetic and diabetic problem, sometimes even pre-cancer, sometimes even psychological, emotional dysfunction, suicidal thought, oppression, depression, bipolar. We see all kind of things, including the high blood pressure, high cholesterol potential risk. The weight is raised up high. The heart condition can be a risk. So cardiovascular disease, heart attack, stroke, all of that thing can be pretty much predict. And we see the patient coming back with, like I mentioned to you, the undiagnosed diabetes problem. So we're going to talk about that. So the other thing that the family dentist can do is we collaborate with dental specialists and medical specialists to help you to bring back to your overall health. So general dentists, we are a primary frontier to treat you, routine procedure, and also collaborate with the specialist team to help you out. You need to come back, otherwise you cannot go straight to the specialist. Untreated dental condition can lead to serious dental condition as well as serious medical problem. So it's very important to come back so we can help you. We at a family dentist, we can educate and support patient for the benefit of having a healthy teeth and healthy mouth. A general dentist can help to explain the routine habit that helps save teeth and improve quality of life. An excellent oral hygiene is significantly important to reduce the major dental emergency, especially preventative procedure really help you to avoid major problem that including gum problem, teeth problem, as well as we can screen your medical issue as well as pre-cancer problem, as I mentioned to you previously. So we encourage patients to see their medical doctor, specialist, and subspecialist, because sometimes patients don't know that they have problem, medical problem, psychological problems, emotional problem. We at the family dentist, we take care dental care for them, but we can also see how they change. a lot of people neglect their medical doctor because of the pandemic. So they don't even see the doctor, don't see the dentist. So when they come back to me for the emergency care visit or dental coming back to visit, I really encourage them to see their family doctor again. I can recommend them to get the blood test for the sugar problem or cholesterol problem, other problem that they don't know. So typically with the one blood test from your medical doctor, you can pretty much help to see how your cholesterol, your blood pressure, your abnormal hormonal change, autoimmune disorder, pre-cancer, and cancer. A lot of our problem that we can talk about. So anyway, so why the next topic I want to talk about is the dental tourism controversial discussion. This is a very hot topic. Should you go travel to other country to get dental care? Yes and no. For example, if you travel to a different country for a vacation and you have a broken tooth, well, you need to get it fixed unless you don't care. Then you can go back to your dentist and take care. But if anything considered an urgent matter, like a cosmetics problem, the tooth that hurt you, you might have to see your doctor, to a dentist in another place in the world to take care of you. But ideally, to me, I don't recommend my patient to see and doing major work for dental tourism. The reason is that it will cost a lot more to fix the failed work that the doctor done from other country. And when you come back to America, it costs a lot more money to do it. And also your doctor is not familiar, or your doctor is not familiar with the work that the travel doctor, the tourism doctor do, because some of the philosophy that we learn here in the United States is very different with other country. So every country have their own standard of care. In America, we are conscious at a dentist, at a family doctor, as a specialist, we are consciously work toward the highest standard of care to protect our license, to protect our business. So we have to keep up with the great work, and therefore, when we see the work done by other country, sometimes it could be substandard of care and could be hard to retreat or take care of the problem. Here, an example of an implant. If you have this implant placed like that, and you can see it doesn't take long to have a bone loss around this area right here. So when you have the work done, multiple implant done by another dentist in other country, unless that doctor are well trained and have digital X-ray and also evaluate you. But the problem, even he is a well trained doctor, you still, every specialist, every doctor in America, whether you are in another country, we always have an issue with the body. But what happens if your body doesn't take the implant? And whether you put beautifully a perfect location in the mouth of the patient, if the patient mouth have an issue, their immune system is weak, their physical condition is weak, their emotional problem is weak, the implant will fail. So that's the problem. We're not saying that the other doctor in other country are not good. We're just saying that there is an issue with doing major work in other country and coming back here, because the doctor, you only spend a couple of weeks or a couple of months there. You don't really have a chance to have the doctor fully evaluate your body, your psychological aspect, your emotional problem. And then now you come back to America. Of course, you will suffer, because doctor, family doctor, dentist, or specialist, we need to have a relationship, a rapport with you, and learn not only your psychological aspect, your physical, emotional problem, your well-being, so we can take care of you better. This is another example that the root canal done, that it fell and it penetrate to the bone, so it's not good. This is another third implant case that nice work done by another doctor in other country, but you can see there is a problem with the implant right here, every doctor have different design and reconstruction case by their standard. But when it comes to routine follow-up, the doctor know best. The doctor who treat the case know best. And if you let the new doctor come in, he or she will have an issue because he's not familiar or she's not familiar with the previous treatment. So anyway, this is another case. So sometimes you can have a beautiful smile, look really nice, but if you look closely, your gum is so red and bleeding. This is not good. This indicate that there is a violation of the margin of the crown. That's why there is a bleeding gum, a chronic inflammation. Eventually, those teeth will have a major problem. Same other case right here. So nice veneer, nice crown doesn't mean it's fine. You need to have a doctor that specialize in this to routinely manage your case. If you have the work done by your one doctor, you should continue with the same doctor to have a good care. If anything happen, she can take care. But for now, you move from other country to this country, and then you expect the same care. It might be difficult. I'm not saying we cannot do it. If the standard that the other doctor provide is the same standard that we have here, then we okay. But when the standard is different, then we have a major problem. So I want to say thank you for the opportunity to share with you my two quick topic: post-pandemic and the role of the dentist, as well as the idea of dental tourism. Should you go to different country to get the dental care? Thank you for watching. I hope to see you next time, and don't forget to subscribe my channel and see you next future video. Love you guys. Take care.